What is hip joint replacement? And why do I undergo hip joint replacement? And what are the complications resulting from hip joint replacement? And what are the things I should do after having a hip joint replacement? Let's talk in detail about hip joint replacement. What are the reasons for undergoing hip joint replacement? The first reason is advanced osteoarthritis in the hip joint that hinders my movement and makes me unable to move, while also causing chronic pain, even at rest. The second reason is a fracture in the neck of the femur in older age. The third reason is having a problem with the blood circulation going to the head of the femur, which eventually leads to the erosion of the femur bone. These are the three common reasons for joint replacement. Secondly, for us, we perform hip joint replacement by making a surgical incision on the left side, meaning from the outside of the hip. And we perform the joint replacement. The types of hip joints vary depending on the patient's age and the type of bone, including ceramic, polyethylene, or metal. And the surgeon determines this based on the patient's age and the nature of the bone, whether there is osteoporosis or any other issue. The most important things after performing a hip joint replacement are to walk with the help of a puck walker for the first week. Secondly, we must be careful not to perform certain movements, which means I shouldn't cross my legs after the joint replacement, or sit in a squatting position, or lift my leg at an angle greater than 90 degrees. These are things we must avoid to prevent the dislocation of the hip joint. After that, we start doing some physical therapy to strengthen the thigh muscles and the gluteal muscles. The process doesn't take long, and the patient starts returning to their normal state about 6 weeks after the surgery. God willing, may everyone be granted healing. Peace be upon you.